a marriage is another. So, there's all kinds of exceptions to the once a year. But if you are older than 26 and you decline coverage now just because you say, I don't want it, you will not have the opportunity to enroll again until next December. That's what open enrollment is all about. If you don't have any other means to get health insurance, personally, I think it'd be kind of silly not to take one of the plans where you pay nothing for it, because Capstone's covering it. A couple of those bronze plans. You might as well have something. You're gonna pay a penalty if you don't have health insurance. And this year, the penalty, for 2015, the penalty goes up to 2% of your household income, which I assume is higher than the $95 penalty, which jumps to $165. Other questions?
How does this impact current dental? Because right now, since I'm on my parents' medical, I only have dental through Capstone.
Okay, we're gonna stick with the dental that you have. We're not doing exchange dental.
Okay.
And that was my recommendation because exchange dental is kind of iffy yet.
Right.
I think you have a much better plan with Excellus. Basically every dentist takes Excellus. Nobody runs into any network issues. Dental renews January 1st. So there will be a slight increase in the cost, and they have not issued the January rates to us yet. As soon as they do, I will let Lisa know, and she can let you all know what it's gonna cost you for 2015. It's a little crazy that they don't have dental correspond to your open enrollment.
Yeah.
It's all calendar year. Okay, so this is just medical for now. Oh, and people who want to opt into dental, that would be during the month of December. So, I'll let you know what's going on with that. And that's voluntary here, correct? Yeah, so if you want it, you pay for it. Other questions? Do y'all think you understand how you get in process? Remember, invitation code, no. Say no. Or you're gonna keep getting the same error message over and over. I guess, I thought there would be.
What about
maybe
plans?
some-
Do we talk about
I
plans?
figured it out, come on.
Is there, did we map one
You
that's more closely to
I
Al?
did, I
What's closely
kinda
related to Al?
opened my plans.
Yeah, I showed them how to
I
go
was
in
just
and
messing
open it
around
up so
with
they
it,
can
and
see
I hit
details.
Which one is it that we're
Still
saying
this
is
one, and then I was
closest
like,
to what we have now?
Oh, I see what
Over
you're
13,
saying.
why don't you just
No.
wait?
Guys,
So it,
we're
Well,
gonna,
it's the
It's a
2000,
silver.
Saying the same thing.
it's the 2000 or the 2100 are the closest to what you get, the silver
So
level.
I can open both of these up. So-
You can, yep. You can always do up to 3 plans. So these are the closest to what you currently have. And then, again, to see details, you just click all these buttons for anything you want to see more detail on, and it will pull up for you. Want to click some more? So they get to see everything. And there are differences between these 2 plans. Here you're looking at, and this is after the deductible is met, always. So on this plan, you have a 20% co-share after you meet the deductible versus this plan where you have flat co-pay amounts after you meet the deductible. Some people like flat co-pay amounts because you understand the dollars and cents versus 20% of what? What's the full charge gonna be? So how do I know what 20% is gonna be? So if you're a hard dollar fact person, you're probably gonna like this plan a whole lot better than the percent plan. This is the $2,100 deductible, this is the $2,000 deductible.
how is the deductible met? Is it just a monthly rate every month that you pay until the year is up and that's what you have, or?
No. Hey, the premium is 344.64,
Yeah.
okay? And I don't remember the cost share if we go
Right
back.
there.
Oh,
Total employee.
okay, so if you pick this plan, you would be paying $64.64 a month.
Yeah.
And then divided by your paychecks, of course. Okay, so let's say you stay healthy and you don't go to the doctor at all. You have no other charges other than the $64.64. The deductible means what you're spending out of your pocket to go see somebody for something.
Okay.
Okay, there's some preventive benefits that are no charge, not subject to the deductible. As a male, you can go get an annual physical and a flu shot, and there's no charge. You're not old enough for it. They do a free prostate screening and a free colonoscopy. You don't qualify age-wise for either of those. Females get a free physical, flu shot, mammogram, pap smear, routine OB/GYN visit, colonoscopy, but most people here don't qualify age-wise for that. Those are 100% paid for, not subject to the deductible. Yes. So, if you are the healthy person who never sees a doctor, maybe doesn't even have a doctor, they're encouraging you to go get a physical every year because they want to see you before you're in stage 4 of something. You know, they can find things wrong with you by doing a preventive exam every year. So those of you that haven't been in years, you should really go. My husband gets a letter from our doctor, I haven't seen you in 8 years. You don't come in soon, I'm not your doctor anymore.
That's me.
No. Yeah, that's not good. Not good.
I have not gone.
You should go. You should go. I'm encouraging you to go. Physical, those of you that like getting a flu shot, there's 2 ways to get it free and avoid being charged for it. You can go to any pharmacy just about now and get a flu shot, and you won't be charged. The other way is to get your flu shot at your annual physical. If you call your doctor and make an appointment for a flu shot, the flu shot is free. They're going to charge you for the office visit. That's one of those little quirks of this preventive free. It's not really. So those are the ways. Go to the drugstore, go to the pharmacy to get it, or get it during your physical, and then it will be free. What else? You're all free to call me. Lisa, email them on my cell phone. Seriously, any question as you're going through here, anytime, I get calls during the year, people just don't understand their benefit, or they get a bill and don't understand the bill. I'm always happy to take your questions and help you with anything.
So we gotta wait till December to do this?
No, thank you, great question. The drop dead date is October 31st. If you are not done, confirmed by October 31st, you're out of luck, okay? This is happening now. Please don't wait till October 31st in case something goes wrong.
Because it will.
Yeah, Friday at 5 p.m.
I was listening to a webinar about the first year of enrolling on the exchange. 38,000 people in New York enrolled on March 31st. That was the last day of open enrollment for individuals last year. 38,000 people were procrastinators.
Or could have crashed the site or something.
See,
So
I helped a couple of people that day, so I know.
Jane,
Yeah.
if you're covered by a spouse's policy, then do you have to do anything?
Yes, you've got to
You
decline.
still go in and decline?
Yeah.
Okay, thanks.
Yeah. Everybody has to do something, or it's gonna leave the
Make it look
employer
like you're
thing
not.
incomplete,
Oh, okay.
okay?
Good to know.
So I'm gonna be monitoring, now that we've done the meeting, I'll be checking in. I have 4 groups on the exchange for December, so I'm monitoring to see how it's going.
Okay.
I will be pestering Lisa.
I'll send out a reminder so that we make sure everyone gets.
Yeah. Yeah, give yourself time to go through the process.
There's a meeting.
Hours?
I've got some really dumb questions.
Oh, 3 miles.
He's gonna pass the login screen. Can you go back to the login screen?